of accusations without details.
The things you said before this committee that didn't turn out to be true. You also promised Chairman Cassidy that the FDA would not change vaccine standards from, quote, historical norms. But what happened as soon as you were sworn in? You announced new standards for vaccine approvals that you proudly referred to in your own press release as a radical departure from current practice. And experts say that that departure will delay approvals. You also said, specific to the measles vaccine, that you support the measles vaccine. But you have consistently been undermining the measles vaccine. You told the public that the vaccine wanes very quickly. You went on the Dr. Phil show and said that the measles vaccine was never fully tested for safety. You said there's fetal debris in the measles vaccine. And this morning—
All true.
This morning in
Do
front
you want me to lie to the public?
That's not— none of that is—
Of course it's true. Of course it's true, Senator. Senator, begging your progress, you do not know what you're talking about.
For the record.
Let's have a little bit of order so that you can get
Madam
your
Chair,
question and we can get
I didn't ask for a response yet.
I understand
I'd like to
that.
lay out the predicate of my question before I'm interrupted by the witness. He should
Go
have some
ahead.
respect for this committee.
Go ahead.
A secretary accused of lying under oath. A senator calling it dangerous, not just for politics, but for public health. Chris Murphy just confronted Secretary Kennedy for breaking his promise on vaccines, and this exchange exposes how deep the distrust has gone. If you care about truth, accountability, and science, stay tuned. And don't forget to subscribe, like, and watch till the end. This one says a lot about who's really playing with people's lives.
Thank you very much, Madam Chair. Secretary Kennedy, I want to talk to you about your relationship with this committee and this Congress. I want to talk to you about the statements that you made to the chairman of this committee and to members of this committee during your confirmation hearing about vaccines. You didn't tell the truth. I find that to be really dangerous for our relationship. If I were the chairman who believes in vaccines and voted for you because he believed what you said about supporting vaccines, my head would be exploding. In the hearing, you told us, quote, "I will not work to impound, divert, or otherwise reduce any funding appropriated by Congress for the purpose of vaccination programs." That's not the truth. You've done exactly. Let me finish my question.
Yeah, I didn't hear what you said. I'm just asking you to repeat it so I can understand your question.
During the hearing, I'll repeat it. During the hearing, you said to this committee and to the Finance Committee, "I will not work to impound, divert, or otherwise reduce funding appropriated by Congress for the purpose of vaccination programs." That is not what happened. You've done the opposite. You canceled $12 billion in grants to the states, including my state, that are used to administer and track vaccines. You promised Chairman Cassidy—
When did I do that?
Madam Chair, would you allow me to finish my question?
Keep going with your question.
When did I do that?
Let me finish my question.
Accusation. Just tell me when I did it so I can understand what the question is.
You have canceled $12 billion in public health grants to states, whether you know this or not. That funding is used by the states in part to be able to administer and dispense information about vaccines. Mr. Secretary, let me give you the full panoply of
accusations without details.
the things you said before this committee that didn't turn out to be true. You also promised Chairman Cassidy that the FDA would not change vaccine standards from, quote, historical norms. But what happened as soon as you were sworn in? You announced new standards for vaccine approvals that you proudly referred to in your own press release as a radical departure from current practice. And experts say that that departure will delay approvals. You also said, specific to the measles vaccine, that you support the measles vaccine. But you have consistently been undermining the measles vaccine. You told the public that the vaccine wanes very quickly. You went on the Dr. Phil show and said that the measles vaccine was never fully tested for safety. You said there's fetal debris in the measles vaccine. And this morning—
All true.
This morning in
Do you want me to lie to the public?
That's not— none of that is—
Of course it's true. Of course it's true, Senator. Senator, begging your progress, you do not know what you're talking about.
For the record—
Let's have a little bit of order so that you can get
Madam
your
Chair,
question and we can get
I didn't ask for a response yet.
I understand
I'd like to
that.
lay out the predicate of my question before I'm interrupted by the witness. He should
Go
have some
ahead.
respect for this committee.
Go ahead.
Just this morning in front of the House of Representatives, you also said that you, in fact, would not recommend that kids get vaccinated for measles. You said you would just lay out the pros and cons. Okay, so this is the summation of everything that you have said to compromise people's faith in the measles vaccine in particular is contrary to what you said before this committee. You said you support the measles vaccine, but then you have laid out a set of facts that are contested, and I will submit information for the record from experts who contest what you've said about the vaccine, and the result is to undermine faith in the vaccine. It's kind of like saying, listen, I think you should swim in that lake, but the lake is probably toxic, and there's probably a ton of snakes and alligators in that lake, but I think you should swim in it. Nobody's gonna swim in that lake if that's what you say. And so I want you to acknowledge that when you say you support the measles vaccine and then go out and repeatedly undermine the vaccine with information that is contested by public health experts, that is not supporting the vaccine. And so I guess I have two simple questions for you. One is, can you clarify what you said in the House this morning? Are you or are you not recommending that families get their children vaccinated, or are you just giving people the pros and cons? And do you understand that when you say these things about the measles vaccine, what ends up happening is less people get the vaccine? That may be what you want, but do you understand that the result of constantly questioning the efficacy or safety of the vaccine results in less people getting the vaccine? So I don't necessarily want to spend the remaining 20 seconds in an argument over the science, but do you at least understand that that's the consequence of what you're saying? And are you actually still recommending people get the vaccine, or are you not?
Senator, if I advised you to swim in a lake that I knew there to be alligators in, wouldn't you want me to tell you there were alligators in it?
So are you recommending the measles vaccine or not?
What I've said and what I said in—
Doesn't sound like you are, if that's—
Are you going to let me answer? Are you going to keep interrupting?
Are you or are you not?
Are you going to let me answer? What I pledged before this committee during my confirmation is that I would tell the truth, that I would have radical transparency. I'm going to tell the truth about everything we know and we don't know about vaccines.
Are you recommending the measles vaccine or not?
I am not going to just tell people everything is safe and effective if I know that there's issues. I need to respect people's intelligence.
I think you're answering the question. I think you're
And
answering
the reason
the question. That's
that
really
people—
dangerous for the American public and for families.
The reason people have lost faith in this program is because they've been lied to by public officials for year after year after year.
No longer recommending the measles vaccine.
Senator Marshall.
Senator Chris Murphy came in prepared. He reminded Secretary Kennedy of his own words, the ones he said during his confirmation hearing. Kennedy had pledged not to impound, divert, or reduce funding for vaccination programs. Murphy didn't mince words. That wasn't true. Then came the receipts. $12 billion in vaccine-related state grants canceled. Funding that helps states track and administer vaccines, gone. And Kennedy's response? Dodging, deflecting, denying. He even asked, when did I do that? As if billions disappearing was just a scheduling mistake. Murphy pressed on, listing a pattern of contradictions. Kennedy had said he supported vaccines, but then questioned them on national TV. Claimed the measles vaccine was never fully tested, that it contained fetal debris, and that it wanes quickly. Each claim challenged by medical experts, yet repeated by someone sitting in charge of national health policy. Murphy nailed it with a metaphor. It's like telling people, sure, go swim in that lake, but it's full of toxins and alligators. Who's going to jump in after that? When Murphy asked point blank, are you recommending the measles vaccine or not? Kennedy refused to say yes. Instead, he fell back on radical transparency, a phrase that's become his shield for spreading doubt. He said he's not going to tell people vaccines are safe if he believes there are issues. But as Murphy pointed out, that kind of rhetoric doesn't build trust. It destroys it. Because this isn't just a debate over science, it's about public responsibility. When someone in power undermines vaccines, fewer people get vaccinated. And when fewer people get vaccinated, diseases come back. That's not transparency. That's negligence. Chris Murphy's frustration captured what many Americans feel, a health secretary who talks about respecting intelligence while quietly feeding misinformation and calling it honesty. This wasn't just a clash of opinions, it was a warning shot that science and truth can't coexist with political games. Murphy exposed what happens when radical transparency becomes radical irresponsibility. Because when trust in vaccines breaks down, it's not politicians who pay the price, it's families, kids, and communities. If you believe accountability still matters, hit subscribe, like this video, turn on notifications, and tell me in the comments, do you think Secretary Kennedy crossed the line here? Let's talk about it.